Hey guys, in today's episode of Dr. Nora, I've been invited to have a chat to some medical students at Griffith Uni for the General Practice Student Network event, whereby I've been asked to do a nice talk on the perks of being a general practitioner. Let's take a look inside and see how we get on. We're going to have a chat about why it is that you're considering perhaps a career in GP and perhaps a subspecialty as well. I think it's wonderful to see so many people here who are even considering general practice, because we surely do need some good GPs. But before I get going in terms of my specialties and why I chose them, I think it's really important to consider what is your why. Why is it that you want to go into, say, medicine? Why is it that you want to go into general practice? For me, this stemmed back when I was about 12 or 13 years old, and it was quite a tragic event actually. Sadly, my father was misdiagnosed with a cancer by his general practitioner, and this was a cancer that perhaps today could have been avoidable, and he may still be with us today had he been diagnosed correctly by his GP. But I always use that as a push for myself, a pivot to say, you know what, I can be better than that general practitioner. I can be the one that kind of makes those diagnoses, listens to the patients, has to think about what they're presenting me with, what are their symptoms, what are their signs, without missing anything. Because the worst thing you want to do as a doctor is miss a diagnosis and end up with a sad situation like myself. And so for me, going through those endless hours in the library, and behind that picture there is a picture of my library at St. George's, and I spent 1,000,001 hours there, as I'm sure you guys do when you're studying for your exams, and you're sitting there with your books in the head, your head in the books, and you're thinking to yourself, when is this ever going to end? And really, I think you have to fall back to your why. Why is it that you're doing this in the first place? What's your reason for being a doctor? What's your reason for being a general practitioner? Is it because you want to be someone who doesn't miss the diagnoses? Is it something you want to cure people and help people? Always have that in the back of your mind, because surely when you're going through those 14-day stints in hospital, 7 nights in a row, you will certainly need to fall back on something to keep you propelled and keep you motivated. So if there's anything that you learn from today, is just making sure to know what is your why. So now going on to my interests. So as I said before, I have a few special interests, and the first of which I picked up was skin cancer and minor surgery. Now this actually stemmed from, in medical school, I had a real passion for dermatology, and I love dermatology. I thought it was fantastic that you could see a patient who presents with a rash and give them a few potions here and there, and their rash magically disappears. And I thought this was something that I really wanted to engage in. However, I did know I wanted to be a general practitioner, and so I didn't want to go into dermatology. But instead, what I did as a medical student, like you guys here today, I got myself involved in some dermatology awards, and I won a few awards in my medical school and was sent off to a few conferences as well, helping to solidify my passion in dermatology, but also helping to build my career as a general practitioner in the future. Then as I came to Australia back in 2017, I realised that there's a huge need for skin cancer. And as I'm sure you guys know, that in Australia, 1 in 2 people are going to have a skin cancer at some point in their life. And so quickly I realised you've got to upskill yourself as a general practitioner. Now you may not want to do that, and that's completely fine. But if you want to be somebody who does a bit extra along the side, then certainly something like skin cancer could be an option for you. And so how did I get to that point? Well, I ended up doing an advanced certificate in skin cancer through the Australasian College of Dermatologists. And that did take a little bit of time, and it took time because it takes time to do the theoretical knowledge, but also the practical skills as well. But you will learn a lot of suturing, you'll learn about melanomas, and now it just makes me a better rounded general practitioner when a patient presents me with a skin cancer, requiring a skin cancer check, helping them to remove that melanoma. Because we all know that the hospitals are already hard pressed to get patients through the door. So being a GP with those extra skill sets is going to help you, and it's going to help the public system as well. My next specialty is women's health, and this passion actually developed when I was a GP registrar in London, and I was working in a fairly low socioeconomic demographic. And the pivotal moment for me was when a 30-something-year-old lady came in. And I could see from the history from my previous colleagues that she was continually being referred to the termination clinic. And I just thought to myself, why is nobody discussing contraception with her? Why is it that her only option is to be going to the termination clinic? Surely that's just so bizarre. And so I used that as a moment to kind of think to myself, well, I need to empower this lady, because I'm all about empowering people and educating people for the better. So we went through our contraceptive choices, and we eventually found out that the best thing would be to start her on the controlled, the combined pill every day, so that we could prevent her from coming back 4 months later for another termination referral. But I needed to improve my knowledge as well. So in medical school, yes, you get taught about contraceptive choices and you get taught about the different options that you have, but you don't necessarily get hands-on experience with discussing and counselling patients for contraceptive options, or even the subdermal implants or the copper or the hormonal coils. And so what I did was I did a diploma from the Faculty of Sexual and Reproductive Health. And that is essentially a 2 to 3 year course back in the UK, whereby we have a theoretical side of things. So we go through lots of lectures, lots of sort of learning in examinations, but then also has a practical side to it as well. So I completed my diploma and I took this to Australia, and I can be honest with you and tell you that it's probably one of the best things that I've done, because in Australia, actually, you'd be hard pressed to find a general practitioner that knows how to insert the copper coil. A lot of them know how to insert the hormonal coil. And this could be just because the drug companies come around, they teach general practitioners how to do this. But there was a bit of a gap. Nobody really knew how to put in the copper coil. And so in my local area, I've become renowned as the doctor who actually inserts all of these coils. So I get a lot of ladies coming in, and actually one of the representatives for one of the drug companies said that, Dr. Nora, you're one of the most, the doctors that puts in the most IUDs. So that's quite a big badge to have on my jacket. But certainly being able to empower women is such a great thing. And anybody who's of childbearing age, being able to empower them and educate them in terms of what contraception options they have is surely a really good thing. And even more so than that, even not just on the national level in terms of the local situation with our patients, but I actually put out a video on YouTube, because I put a lot of things on YouTube if you're welcome to watch them, about the IUDs as well. And I had a lady contact me from Kenya who said, thank you so much, Dr. Nora. I didn't know about these IUDs. It's really great being able to have this knowledge, and now I feel empowered to now go and approach my doctor as well. So having that knowledge is key. Knowledge is everything. So although you're learning today, and I can see that there's probably some gaps in knowledge still, but as you grow older and you learn more and more in terms of your courses and so on, you'll be able to empower other patients in their choices in life as well. My next subspecial interest is cosmetics. Now, this one you might be thinking, well, skin, cancer, contraception, cosmetics, why? Well, this is actually just something that I found a bit fun, to be honest. I was watching television one day, as you all do, and I was watching Keeping Up with the Kardashians, and don't judge me, but I thought to myself, how is it that Kim Kardashian is 40-something years old and she has no frowns or no lines on her face? And me being very naive back about 7 or 8 years ago, I thought, oh, it must be a moisturizer. So I got all of the moisturizers under the sun. I tried them all on. I thought, this isn't working. Nothing is getting rid of my frown lines. And so then it clicked, obviously my naive brain, that she was probably injecting herself, or someone was injecting her with cosmetic injectables. And lo and behold, yes, although they like to deny that, they surely do a lot of cosmetic injections. And so about over 7 years ago, I did my course in cosmetic injectables in London, and I took this over with me to Australia. And my emphasis is not just to kind of get that big Gold Coast look with the big duck lips and whatnot, but just more for safe injecting, because I don't know if anybody out here have had cosmetic injectables before in the past or have heard stories. There are a lot of shocking horror stories. And as a general practitioner, I'm in a privileged situation to be able to know my patient well, but also to treat them in a safe and effective manner. And so for me, it was really just about giving people the opportunity to know what is available, what is safe for them, without pushing too hard, because I'm not for a hard sell at all, but making them feel empowered and having their self-confidence return as well. I'll just bring you to a patient of mine that had some cosmetic procedures, and it completely changed her life. I mean, it sounds very corny, but it did. So this lady of mine, she presented to me, and she had never had any cosmetic injectables before, and very, very sweet middle-aged lady. And she really wanted to get rid of her frown lines. And this is somebody that doesn't really go out much of her home, because she's actually quite got low self-confidence in herself. So obviously, being a good doctor and knowing this patient, you have to take a psychosocial history from them, make sure that there's no body dysmorphia, because you don't really want to delve into somebody who's got psychological issues and then inject them. That's the wrong thing to do. So with this lady, we kind of we had a bit of a plan, and we ended up doing her anti-wrinkle treatment to her upper face. And instantaneously, she came back to me the next day and she said, do you know what happened, Dr. Nora, when I went home that day? And it doesn't work that fast, I'll just be honest with you guys. She said, this guy in the lift said I looked really good. And he said, wow, I should go out more often. And she was just beaming, and it was just so nice, even though I know that cosmetic injections don't take that long. They take about 2 weeks for them to work. But the fact that it's a placebo. But the fact that she said to me, literally, one day after, she had this resounding compliments from her housemates, just made me think, that's a really nice thing for me to be able to offer to my patients, as long as it's safe. And so eventually I got headhunted as a cosmetic injector, training around Australia, doctors, dentists and nurses by an international training academy. And we went around, we used to teach doctors and nurses how to do safe cosmetic injectables, which is also a really good thing as well, because we're helping to now get the future of tomorrow safely injecting as well, which is so important in this field. But one thing I noticed as I became a cosmetic injector, and even now do my day-to-day life, I noticed that if any of you've seen Instagram, or if you're familiar with before and after pictures, when people are having their cosmetic injections, people often post pictures online and the before and after pictures look a bit dodgy. They often look a bit sort of mal-rotated, or you can just tell that the cosmetic injectors try to do a fast one by making it look like they've got a really good after picture. You think you know what I'm talking about. You're smiling away there. But sometimes you see the picture and you think, well, what's going on there? It doesn't look like there's any difference, or that looks really dodgy. So anyway, I took this upon myself and I thought to myself, well, I don't want to be that kind of person that does these sort of dodgy dealings, as you can tell, with my patients. And so there was a little gap in the market that there was no way for anybody to take accurate before and after pictures. And so what I ended up doing is I ended up developing my own application, so an app that you can get used on your iPhone or your iPad that actually uses artificial intelligence to help to line up those pictures and crop in and zoom in and make sure that they're completely accurate side by side. And now if you are to go into cosmetic medicine, there is a huge amount of guidelines from APRA, and a lot of them say you can't, your before and after pictures must be the same in the background and the color, in the lighting, in terms of the orientation as well. And so using all of these guidelines, I developed this app, which is now, it's gone global. So we've got hundreds and hundreds of clinics using it around the world. It's called Treatment Pad, if any of you are interested. And a lot of clinics using them in America, Russia, every country in the world possible. So you often get opportunities from things that you would never imagine. So going from somebody back in the UK over 7 years ago, just doing cosmetic injections because I want to do it because it's nice and safe, to now being somebody who has an app under their name and it's being used by hundreds of clinics in the world, and being able to present as well this app to lots of conferences internationally and nationally as well. So there are loads of opportunities as a general practitioner is what I'm getting at here. You don't necessarily have to do these things, and it's completely fine if you don't want to. But there's a whole heap of stuff that if you guys are interested in, the doors will just open up for you if you wish. And aside from all of that, I am also a GP as well. So not only do I do skin, family planning and cosmetics, but I'm also a GP, and I love my job. Just like my colleague who spoke earlier, GP is a very rewarding career. You get to see patients from day dot all the way through up till however old they'll be. And generally, my life as a GP, it's great. I can't complain. It's something that I always wanted to do. And I said to you before, my why was that I wanted to be that person who wasn't going to misdiagnose people. And I feel that, as a general practitioner, I have the ability now to be a safe doctor and to listen to those signs and symptoms that a patient might have and not miss those diagnoses. In terms of a typical day as a general practitioner, it is obviously varied for everyone. But for me, so what I tend to do in the morning, I'll get to my office and we'll go through the results of the patients, making sure that there are no abnormal blood tests, imaging, etc. And then there's obviously a recall system that we have for patients as well. Then usually a day-to-day in a general practice will be that you'll see, say, 20 to 30 patients, depending on how long you're working for during your day. And it could be an array of different patients that you're seeing. So one morning I could be seeing a baby for a baby check, for a 6-week baby check. And then I might then be putting in an IUD, say, and then I might be doing some cosmetics. So it could be, or I could even just be seeing a cough or a cold as well. So you have a complete variety of patients that you usually see. And I think it's that keeps you on your toes, because remember, you are the person who's the first port of call for a lot of these patients, and they'll come to you with their presenting symptom, and you sort of have to be a bit of a detective and work out what it is that's wrong with them and how you're going to best treat them as well. So if you like a bit of detection and you like being a bit of a Sherlock Holmes, then maybe GP is a career for you. So usually after seeing a bunch of patients in the morning, I'll have a bit of a lunch break, and then it's consolidation with my colleagues as well. And often we'll go through a debrief if there are any cases that we need to discuss. And then we'll resume back in the afternoon for some more patients. And then at the close of the day, for me, myself, I sometimes work during the daytime, so it could be from 9 till 5, and sometimes I do after hours as well. But one thing that you will get with general practice is you will get a good work-life balance. I know certainly my colleagues who are doing surgery, they'll have to have their on-calls. And, if that's for you and you like the thrill, then absolutely go for it. But if you, you want to have a bit more of a work-life balance, completely, that's up to you as well. That's something that I opted for. And as a new mother as well, I've got a lot of time now to spend with my little baby. But I also have a jet ski as well. So just bear that in mind. So if you do want a bit of normal work-life balance, I think general practice is a good way forward. And of course, it is really all about the patients. As I mentioned before, as a general practitioner, you often get your love for your patients. You'll see patients who have presented to you. For example, I have a lady who didn't know she was pregnant, and we did a urinary pregnancy test at the spot, and she turned out to be pregnant. And now I'm seeing her little child, and she's now 3 years old. So it's that continuity of care that no other specialty, in my opinion, has. Surgery doesn't have, dermatology doesn't have. You often see clinics, you see the patients in and out, but general practice is the one that you're going to have. You're going to see that patient all throughout their life, hopefully, if you stayed in the area for long enough. But then also it does come with it some sad times as well. And very often I've met a lot of patients who I've sadly had to say goodbye to because it's their end of life. And so it does have a mixed emotions, but generally speaking, it is such a rewarding, fulfilling career. And this is my lovely patient behind me here, who's an absolute treat. So you do get to meet some real special people as a general practitioner. But if you don't want to do any subspecial interest and you think, you know what, it's not for me, that's completely fine, because as I said, you would be a generalist. So you're going to be the person that people are going to see from day dot. So they'll come to you and they'll say, hey doc, I've got this issue with my tummy. What can I do about it? And you are their portal. So you're their first point of contact. If you weren't there, then who will they go to? Probably Google, but that's not good. But you're the person who's going to take them through their investigations, through their management, and through their plan as well. And they will forever be in debt to you, and they'll love you for it, especially if you're a good doctor as well. And just like the RSCGP says, you're a specialist in life. So you're not just a GP, because we don't just say, oh, I'm just a GP. You're actually a specialist in life, which means that you've got the ability to help this person throughout their life, whether it's through mental health, whether it's through family planning, whether it's through skin cancer. You're their number one. And there are certainly patients that I've seen that followed me from practice to practice. And it's such a blessing to be in that honorable position. Thank you very much, everyone. Take care. Hope you guys have found that video useful, and I'll see you on the next one. Take care and stay healthy.